Okay, I'll kick us off. Good evening, everyone. It's Thursday, October 2nd, 2025, and Mayor Hodson will be joining us here shortly. So let's begin with the Pledge of Allegiance. And Jamie, you have a flag for us? Great. Okay, thank you. I pledge allegiance
to the
to the flag
flag
of
of
the
the
United
United
States of
States of
America
America,
and to the
to the republic
republic for
for
which it
which it
stands,
stands,
one
one
nation,
nation,
under God,
but indivisible,
indivisible, with liberty
liberty and
and
justice.
justice for all. Thank you. All right. Um, so I think we all know each other, so I will forego any introductions because I know we know each other. And we will move right into the agenda, and that is first thing on the agenda is housekeeping. So Jamie, do we have a quorum?
You're
I
muted.
don't believe we have a quorum quite yet, but maybe we
Okay.
can check back in after our first item.
Okay. Is our presenter here yet?
Yes.
Okay, great. So why don't you, I'll just turn it over to you to introduce our guest, and we'll carry on.
Recording in progress.
Thank you very much. Good evening, C4, Jamie Lorenzini, your staff admin. Tonight we're doing something a little different. We are having a theme night, the theme being emergency transportation. I'm pleased to introduce our first presenters, Jeff Owen and Jay Wilson, and I believe we're waiting on Christine Lewis momentarily to remarks, but I don't see her in the audience quite yet. Jeff, are you comfortable proceeding into your presentation? And then we'll circle back to Councilor Lewis.
Absolutely. Happy to. And yes, feel free, of course, to just interrupt when she does join. So myself, hello, I'm Jeff Owen with Clackamas County, a principal transportation planner, part of our kind of long-range transportation planning team. And myself and Jay, who will introduce himself next, have been kind of your links from the county, some of your links into the project on the agenda. The project team, the project manager was unable to join us this evening, so myself and Jay are here to make sure that you are aware of the topic and making sure to pencil in the items here soon to come on your calendars or passing them on to your team, your staff, to make sure that we do get all inputs we can into this topic of regional emergency transportation routes. Your packet does contain a fact sheet, a kind of front back 2-page fact sheet that has a lot of information about the project. It is a co-sponsored project between Metro and the Regional Disaster Preparedness Organization, our DPO. The reason this is part of C4 and not just kind of C4 Metro is the fact that it is a large geographic look at over 5 counties. So I want to make sure that's highlighted. So I'll take a pause and pass the mic over to Jay as well to give an introduction.
Thanks, Jeff. Good evening, everyone. I'm very happy to be here representing the county's Office of Disaster Management and a member of the team that's working on the regional emergency transportation routes. My title with the county is Resilience Coordinator, and I primarily manage the hazard mitigation program for the county, the 5-year plan that we update, and mitigation grants and projects. And so my role in this process has mostly been someone providing context in relation to the county's identification of hazards that would come into play in terms of the long-range planning for these routes. But happy to be here and answer questions. So thanks, Jeff.
Absolutely. So what we'd like to do this evening is to, in fact, very quickly give you a little bit of that rundown of a slide deck that is included in your packet for this evening. And just want to be quick about this. Again, this is a project co-led by Metro and the Regional Disaster Preparedness Organization. myself and Jay kind of pitch hitting here just a little bit, but we want to make sure you're aware of this topic and all the ways that it does relate into the important work underway. Let's see. Sorry, I can't quite do a next slide here just yet for some reason. Okay, sorry about that. So, emergency transportation routes. The project team, led by Metro and RDPO, have defined these routes as priority surface roads targeted during the emergency for rapid damage assessment, debris clearance, life-saving and life-sustaining response. This designation may also factor into long-term maintenance and investment decisions. So there's a lot there that we definitely want your feedback on this evening. There is a brief history in the region, of course, sorry, a long history, but a brief recap here of designated emergency lifeline corridors, 3 counties, 6 routes of ETRs, and over time, there have been quite a number of efforts to expand this work and grow the effort over time. And so as this started with 3 counties, it has expanded again to 5 counties here in the 2021 effort, as you see on the screen. Phase 1 of the work has already occurred behind us. That updated the network to the 5-county region. Phase 2, the work underway prioritizes in tiers the network routes. This is an output of Metro's regional transportation plan. What's important to note as well on the right side of the screen is what Metro and RDPO are showing as all of the resilience planning efforts, with the ETRs simply one piece of the puzzle inside this diagram. The project team is listing kind of what is out of scope as well. Evacuation, recovery, operational guidelines, or funding decisions. The way that they have structured the approach is there's a quarterly project work group that we are links for your eyes and ears there. The project team has held technical workshops to develop and refine prioritization criteria. There is also engagement with community organizations and briefings, such as this one. Also at tables around the region and counties. Where the project is now is at a draft, kind of a draft result. So it's a really perfect time to understand what has gone into the work to date and understand if you're not quite seeing what you'd like to in the end result here, this is the time for trying to make sure that extra inputs can be inserted into the project to make sure that all the tier 1s that really need to be considered are part of this exercise. So to date, just a very quick summary, this has been a quantitative, thorough exercise that has used scoring criteria. Roadway networks around the region are broken into segments. So while this is a corridor approach in distance, it also is trying to recognize that at some point a corridor is quite long, and so it's broken into segments. There are categories here on the screen with buffer distances and whether a certain corridor segment has this characteristic, it kind of gets a point for having something like, hospitals, airports, etc. Kind of dots on the map. It would get a point within this buffer distance of the element. So that does lead up to a quantitative score. Your packet as well contains a link to an interactive online version of this static image. So I do encourage you, if you'd like, to click that link and go to the site yourself if you'd like to kind of pan around and zoom in. It has the ability to turn some layers on and off that help to give context, show the dots for hospitals and different entities that have geographic points. The important thing to note too here is almost starting with the blue. The blue are the statewide routes for both Washington, north of us, and Oregon. So that's almost the piece to start with. After that does become the highest regional scoring, 6 to 9 of that kind of dark red or maroon color, and then orange kind of being medium. And then the yellows are what are quantitatively so far scoring lower. You might notice, of course, there are some places in Clackamas County that have more of the yellow and less of that dark red maroon. That's why we're bringing this effort to your attention tonight to get your feedback. The team has already started to incorporate some of our feedback that myself and others, Jay and others around the region have shared. In the first bullet, for example, to really think about that tier one that's also more evenly distributed around the region. One way I've also tried to get the team to think about this is maybe distance thresholds. Over a certain distance, there should at least be one tier one part of the grid that's connected in. Also maybe thinking about areas that might only have one way in, one way out, those kind of characteristics to incorporate. So there are a number of pieces of feedback here. Bridges, I would mention, have been a point of discussion in the work group recently. The thinking there of why the team has removed bridges is that, of course, on the one hand, they are a crucial piece of a network functioning. But there again, on the flip side, it also perhaps is a risk or a weakness if the bridge goes out, depending on what type of an event it is. So the team has decided to not necessarily give a point or a negative for a segment having a bridge, but rather to kind of deal with bridges separately so that they can be evaluated on their own. One more point of feedback here to highlight is things like hospitals and airports. That has really come back to start to rise to the top of something that should really ensure there's a tier one corridor connecting to hospitals and airports, such as PDX. So with that, I really want to make sure we give the bulk of this time back over to you here for feedback that myself and Jay can take notes on and take back to our different teams, and welcome all the input you have. There will be here on the screen November 12th, I would highlight for your awareness. That's the next, it's kind of a 2-hour window of an interactive workshop that the project team is planning, where anyone who would really like to roll up their sleeves and dig in person, they plan to break up the groups in the large room into county focuses so that different folks who are really knowledgeable on the topic can really dig in closer and talk together. This effort will include 2 more project work groups into December, February, and look for an endorsement process into spring. So with that, I just want to make sure and again clarify this is a joint-led project from Metro and the Regional Disaster Preparedness Organization. And I would offer up that the team is very receptive to input. Myself and Jay are here to listen, take notes, and then this topic will also come up, here soon at JPACT and other forums as well. So unless Jay, I've missed anything super obvious, happy for you to add in there. But we're happy to kind of join in your discussion and listen in. And I don't believe I see Councilor Lewis just yet, but if she's able to join, she may want to chime in, of course. So Jamie, back over to you perhaps to kind of guide us through discussion.
Yeah, it's a really good presentation about an ongoing process that's been happening in the region, but is not limited to Metro's boundaries. Thinking about how do we prepare for a disaster and think about which roads get cleared first. Are there any questions from the group? All right, seeing that.
Yeah, Mayor Hassan, you want to take over and acknowledge hands?
Sure can. We'll start there with Mr. Hilliard. Go for it.
Yes, I was wondering what, on the feedback, what is it meant by community resilient hubs?
That's a great question. I believe I don't have the exact definition here for you in this moment. Apologies, but yes, we can definitely take note of that and figure out if we can get that for you during the meeting, or that may be something we need to circle back with OJ. So
I can chime in a little bit. The at least the way those hubs were proposed a couple of years ago by the State Department of Human Services, they were nodes of providing resources after disasters, tied in with distributions of things like food and water, but also prior to the disaster, areas for people to congregate for sharing information or things like charging phones or just distributing information for public meetings and things like that. But there was a grant program that they had, I think it was a one-time thing, but there was a lot of interest in it from a number of communities. And I think it's a concept that's going to continue and roll forward. So they certainly wanted it to be a part of the overall resilience themed planning that Metro does.
Okay, thank you.
Mr. Owen and Mr. Wilson, thank you for your presentation. Not an easy lift, I'm sure, as an ever-changing environment in terms of the emergency side of things. A couple of things. One, I wanted to talk about the removing bridges from the criteria. Did I understand that? So, in looking at the criteria, it sounded like you said that the bridges were not a negative point against, these connectivity aspects of it. However, I think a city like Canby, we're surrounded by bridges. Something happens, and I just think about, myself, I live in Canby, work in Tigard. All I've got is a ferry and bridges to take to get back to Canby if there's a problem. I mean, I can understand not, I guess, penalizing, for that having a bridge, but I guess how do you counter, how do you account for that in terms of this kind of criteria or laying this out? That's number one.
Yeah, I do believe that's obviously a very valid point and concern. There was a lot of debate that I did hear as being part of the work group team about whether that should really be elevated, that bridges should help to elevate roadway segments into tier 1 because of their vital importance. But it was just a continued debate about that could also introduce risk in the event of having to find an alternative route if a bridge went out. And so I would definitely say that we can take that back into the project team and get more understanding of how they intend to move forward. I do think they plan to handle that in some way, kind of on its own as a bridge topic within this effort. But sorry, I can't provide a better answer for you, but definitely understand your point there.
No, that's I fully. At least it's something that's already being considered and looked at, and I appreciate that being elevated. And so I guess that leads into my second question. When we talk about, I think you made the point about airports and PDX. I think also, I know that Canby is not in Metro, and I know that we're looking at something when you talk about the airports with Aurora Airport being south of the Metro area. Does that become a conversation topic with Marion County? And how does that come about? Are they, obviously, I would presume that they're doing their own plan that takes that airport into consideration.
Yeah, I do believe the project team effort underway now, it's all airports in the 5-county area show up as a data set, so that would be included as a dot on the airport layer. A lot of the voices in the room have been, of course, as you could imagine, dominated by PDX itself as being maybe the big one.
Sure.
But yes, all airports in the 5-county region are part of that data set. So their locations are factored in.
Right. And then my third question, and sorry for dominating y'all. Canby Fire has done a lot of work on just kind of, I think, a citywide, but also I think reaching out to within Clackamas County Fire and whatnot and surrounding areas regarding emergency preparedness and whatnot. Is this plan included in a coordinated effort with the different fire pieces, or is this purely just about the escape routes, I guess?
Similar to the last one, all firehouses are also part of the data set, and the invitations for these work group meetings have included representatives from police, fire, etc. But of course, everyone's time is fairly precious, and so their direct attendance may or may not always be there. But yes, they are definitely invited, and we encourage everyone to pencil in November 12th to make sure that all the voices are heard.
Thank you very much. Mayor Milch.
Thank you, Jeff and Jay. Obviously, an important part of this is defining these various escape routes, or whatever you call them. But I know when I go to a public building, sometimes they have a sign that says, in case of fire, this is how you get out, and they kind of show you the way. And I'm wondering, so I think the educating the public as to where these routes are is certainly an important aspect of this. Is there going to be some kind of color coding on signs or something that's done so that people in advance of an emergency are become acquainted gradually with which roads are designated as emergency routes?
That's an interesting question. I'm afraid I don't necessarily have a response to that. I see Mr. Besner is also on camera here. That might be a link into our next topic as well.
Yeah, if you give 5 minutes, I think I'll start talking about that.
Can I clarify that question, please? Mayor, is your question more, excuse me, more about the evacuation side or more about the response side?
You're asking me?
Yes.
My question was, how do individuals know where the designated routes are in their area? We can't, maybe there's not easy communication during an event, but in advance, is there going to be, some kind of a blue star on a sign that lets people know, oh yeah, this is eventually this could be an emergency route. That's what I was just wondering.
Okay, thank you.
But I think Mr. Besner says he's going to answer that question coming up.
Mr.
Yes, sir.
Gornick. Oh, sorry.
Hello. I remember during the 1990s when some of these statewide routes were established, that there was an assumption that because of the underlying foundation soils at PDX, that PDX would be unusable, and that the nearest airport that would be able to handle the larger airplanes would be in like Redmond, Oregon, which of course would put a huge burden on US 26 coming over the Cascades. Does this plan somewhat account for that? And of course, that's not in the 5 counties that you're looking at.
Yeah, thank you for that. That's a really good point. I do think that discussion within this project to date has touched on that just a little bit, and the Port of Portland folks, always chime in and say they're trying to increase their seismic resilient runway funding in order to bring a runway up for seismic resiliency. But yes, your point about Redmond has often come up as well as being an important one to consider there. So we're happy to take that back into the group as well. Very briefly, not sure, Jay, if you were going to chime in on the last one, but I do think that the project team for this effort, in order of kind of public communication, they would say that this effort they're doing is mostly about getting to people and just getting people to hospitals kind of in the immediate aftermath, but not necessarily about communicating to people how to get themselves out as much. And I think that's maybe our next topic a little more so.
I had my hand up briefly just as a response to the clarifying question. To my understanding, these emergency transportation routes are primarily for immediate response and for moving resources in a time-critical fashion. And the little circle diagram that we had seen earlier was showing that the ETRs are within this greater resilience planning framework, but evacuation planning is a separate aspect of that. And so there may be overlaps of some routes that double up in both ways. You may not always evacuate for a given emergency, and so we'll look forward to Mike Besner's presentation to discuss the county's rollout of evacuation planning in a different context, but that is applied across the entire county and the cities.
Thank you. Commissioner Sabas?
Yeah, Mike can probably touch on when he makes his presentation one of the questions I have, but if I heard Mr. Gornick correctly, am I reading in that, and I assume that all you people have taken into account, if it is a Cascadia, the liquefaction aspect, and of course, the farther you get to the port, that's a lot of fill, and I don't know how they seismically fix
Yeah.
a situation like that when it's all soil. So if you can cover that, Jay, a little bit, or Jeff, and then Mike, just my question to you when you make your presentation is just pointing out how many bridges Clackamas County has, and it's significant compared to any other county. And so I'll leave my question there. Thank you.
One brief mention there quickly would be just this morning, the project team did present to CTAC, our technical supporting group here, and there were several questions asked kind of similar to that. One thing the project managers did stress is that they're also trying to perhaps design for ETRs in response to a number of events. Yes, seismic was Cascadia event would be maybe the most major on people's minds, but they're trying to kind of do something that might even be more broad as well. So it is.
Yeah, Commissioner Savas, I'll just quickly touch maybe on a higher level that one of the aspects of this current project is bringing in the most up-to-date kind of soil and site response research that we have with the LIDAR technologies that we've had. We've been able to much greatly improve our understanding of areas, both of where there may be landslides, to map floodplains better, but with lots of soil testing, the liquefaction areas have been much more finely delineated. That doesn't mean that we don't have a lot of areas that are exposed or vulnerable. We do, especially on the margins of rivers. But that also means that it comes into play in factoring, priorities, for example, for state bridges and things that do need to be repaired or upgraded to take liquefaction into account. But that's more of a thematic answer than a site-specific answer.
Any other questions or comments for these gentlemen? All right. And just to kind of reiterate the opportunity to get together with you all. It's November 12th. What time?
It's going to be part of what's factored into the TPAC workshops. It'll be 9 a.m. to 11 a.m. And the in-person option would be at Metro Regional Center in Portland. And then there's also a hybrid option as well to dial in for those not wanting to go there in person. We can make sure and get a link to that event as well, or myself, Jay, Jamie, happy to provide that.
That would be great. Okay.
Mayor Hodson, we have Councilor Lewis has joined us, so if she wants to make any comments, Councilor.
Thank you, Commissioner. I've been listening to great comments for just around context setting. I think some really good points have been raised, and I'm excited by the interest, and in particular in coming through the engagement process. Thank you.
Okay, thank you. Back to you, Mayor.
All right. Thank you, Commissioner Lewis. All right. Gentlemen, thank you very much. We appreciate the update, and we look forward to more in the future. So thank you. Next, moving up on the agenda, it looks like we have an update on evacuation planning. Mr. Besner will be giving us that update.
Yep. Thanks for having me. Good to see everybody again. First, to wrap a little bow on the topic you were just doing, and Jay was spot on. There is a difference between response and evacuation. They're two pretty different things, actually. And most of what those emergency transportation routes are based on response, roads to clear, stuff like that, as opposed to evacuation, where, just to give the most obvious example, there's a huge fire and everyone's got to get out, right? They're two but the roads are okay to use. So they're two really different things. So real quick with response, just so you also know what we're doing as a county transportation department. And yes, Commissioner Savas, we have 180 county-owned bridges. There's more ODOT-owned bridges, and there's a few city-owned bridges. A few of you have them, but most don't. We've actually split the county into some what we call response zones based, and we took employees and looked at where they live and kind of assigned them to zones based on where they live, because we know they're either going to be home already. Might feel like we're always at work, but we're actually at home most of the time. So you're either going to be at home already, or you're going to really want to get home. So, and we have drills, and we have them go around. They're familiar with the bridges in their zones. They already know which ones might do well in an earthquake, which ones might not. So just so you all know, we've got that effort going on. So if something does happen, we'll have employees in the zones ready to help put the pieces back together. But when it comes to evacuation planning, the biggest lesson I believe that we learned from the fires in 2020 was, don't make the entire county an evacuation zone all at once. In hindsight, it seems so obvious, but it did not work. And what happened was, even people who were not under an immediate evacuation recommendation, it was just, just be aware, they left, some of them. And I don't blame people. Everyone's got their own threshold. But that caused problems for the people that really needed to leave because the roads got clogged up. So that was a really good lesson to learn. Luckily, it was a lesson learned when nobody got hurt or killed. And so thank goodness. So, but we learned it. I could tell you we've had some smaller fires since then, and nothing that's really resulted in, I mean, there's been some small evacuations, but nothing, we've had some last year in particular, where we actually got together as a group, started pre-planning, okay, if the fire hits this point, what area are we going to set those evacuation zones out, and to do them in order. So we did them much smaller. There'd be much smaller zones, and wait until someone really needed to. And we'd still do the zones 1, 2, and 3. It wasn't like we'd spring it on them at the last minute. But it was a good lesson learned. So disaster management has been working on a project, and there is a website on the county's website. It's evacuation planning. If you Google it, you'd find it, Clackamas County Evacuation Planning. They've done, it's 3 phases. The first one was a baseline assessment and best practices regarding this. A second one was, hey, let's create some evacuation zones and route mapping. And then the third is public education or public engagement and evacuation preparedness education campaign. And that's the one they're in the middle of. So let me just show you real quick. I'm going to share my screen, I hope. Hopefully you are all looking at this map, and this is in a report, and Jamie put this out in the packet. This is the work product from the evacuation zones. You can see they are really, really small and granular. And the idea is they're already drawn up. So in the middle of the night at 1 o'clock in the morning, because I promise you that's when this happens, and an evacuation alert has to go out, we can say, all right, 15L. And then we work with disaster management. We're already there. When the fire chiefs and the sheriff make the call, because they're the ones who make the evacuation calls, it's not transportation staff. We're able to very quickly get that out. Okay, so a lot of work went into this. So, and it's not a map that's really useful for a lot of people, but it's very useful for us in getting those orders out. There are other maps. Let me share this real quick too. I think I got it here. And they're basically around cities. And I just happen to have Oregon cities up here, where it shows in red, hey, these are the likely evacuation routes you would need to leave a city. And this bottom map is a bit more of a, obviously a larger look. Here's the thing though, it's still a little general. And we're working through how do we communicate all this. But the reason it's general is it 100% depends on what you're trying to evacuate from, right? That fire could be east, west, north, south, in the middle of town. The route really is going to depend on the event we're talking about. And so what we're encouraging people to do is become familiar with maps, become familiar with their zone, and have in mind a couple routes they might already take. And that's part of what the campaign is. I'll talk about that in a second. But when it came to prescribing really specific, like, and Mayor Milch, like you were talking about, like, this is the evacuation road, we're very hesitant to do that because what if that's the road that's on fire? You know, I mean, inevitably it will be. And so we just don't know. But by planning this more holistically and having the individuals be thinking about it, and they know their area really well, right? And in general, they're probably going to go the way they want to anyway, because they know where they want to go and they know the best way for them to get there. The public engagement part of this involved focus groups, surveys, interviews to understand what the public's concerns were about emergency preparedness and evacuation and how they'd like to be reached. Disaster management did they called it a Be Clack Go Prepared campaign, and I believe it ended this summer. Just highlighted simple steps to empower people about their own emergency preparedness. Sign up for public alerts. If any of you are, I imagine this whole group is. If you're not, please do so. They are very important to get. Again, know your routes. Access a map and print it out and put it in your Go kit so that you have it. You know, nowadays with our phones, we probably have GPS, and if the event is a fire, we're probably going to have cell phone service, but it all depends on where you live. It doesn't work out in some of the rural areas very well. Pardon me. The routes were also created in partnership with the cities and special districts. And this was this effort they just, it was the first time all these maps were made available to the public. And then they emphasize build your emergency kit. And I know you've all heard this a lot. Make sure you have what you need. So if you have to make a quick getaway, you can. They're not done. Their next steps, they're going to do another campaign, the Be Prepared campaign. And then they intend to do it annually every spring and talk about lessons learned with the community. And then also, and I'm pretty excited about this part, they're going to do an evacuation planning map tool. They're planning on launching it in the spring, where it's kind of like the GPS thing, or GIS things we already have. You'd be able to enter your address. You'd be able to dig in, see maps, explore different evacuation routes that might be available in the area. And I think that's a great way. And honestly, it really is just educating people about get to know how you would leave. And I do think 2020 was eye-opening for a lot of people, but you know, that was 5 years ago already. We're going to have a lot of people who live here now who didn't live here then. That this effort I'm talking about, pardon me, is being run out of disaster management. So the actual process, I could try answering questions for. I know Jay was on here, but I'm not sure he's on the team that's delivering it. But given that, I'm happy to take any questions you have.
No question for Mr. Besner. Okay. Mike, thank you. Appreciate you being here and piggybacking on the previous conversation.
You bet. Thanks.
Yeah, I think your point on we don't know where the emergency is going to come from, but we have to have a couple of routes that we got to be able to rely on. And some of that's on us and definitely on our local emergency providers. So more to come, I'm sure. All right. Thank you, Mike. Appreciate it. All right. Next on our agenda is an update on the AMR contract. And I think we have Mr. Mason Joyner and Mr. Conway.
Thank you, Mayor. Good evening, everybody. Glad to be here. I am Philip Mason Joyner. I am the Deputy Director of Health, Housing, and Human Services here at Clackamas County, and joined by our real ambulance expert at the county, Bill Conway. He manages our public health emergency services. So I'm going to take lead. Bill, you're going to drive the slideshow, right? He's the expert, but I'm going to talk. And, Bill, feel free to chime in if you have details you want to add, and hoping we do have discussion and you can help me out with any questions that might come up. So let's just go to the next one. I did promise Jamie I would keep this pretty high level. Just an overview of the county's new ambulance contract with American Medical Response Northwest, or AMR as we often call them. So Clackamas County, we have a role to oversee and to regulate ambulance transport services for the community. It's outlined in state statute. Every county in Oregon is required to have an ambulance service plan, which is approved by their Board of County Commissioners. And this plan really guides all the associated contracts, IGAs, MOUs, all other agreements connected to this work, so that ultimately the system is coordinated, it's all connected, and it's as safe as possible. So when folks are having a really bad day and needing to call 911 for medical need, it's there, it's reliable, it works, and it's of the highest of quality. In Clackamas County, we have divided this work into 3 different regions, which we call ambulance service areas: the Clackamas ASA, the Canby, and the Molalla. And if you go to the next slide, we have a map that shows what it looks like. Maybe a little bit difficult to see, but you can see Molalla and Canby, of course. Those ASAs are run by their respective fire departments. And the Clackamas ASA, this is really what is centered around the contract with AMR. So very large territory, and the contracts holds AMR accountable to all of the different requirements and all the financials that I'll go over in a little bit. And while Molalla and Canby, those respective fire agencies take lead, they do the first response, they do the transport to the hospital. There's a lot of mutual aid that happens between all the agencies. EMS is really a team sport. Okay, let's go to the next slide. So the new contract with AMR was finalized back in late July this past summer. It's a new 10-year agreement with AMR, and it took over 2 years of negotiation. We've been through a lot. We did actually enter a lame duck period where things were really going down to the wire, but ultimately the contract was approved by the Board of County Commissioners, assuring we still have 24/7, 365 ambulance services for the community. And there were several sticking points. I know someone had a question primarily curious about the patient rate increases. That was one of the big reasons why we were delayed in our negotiations, because patient rates, they have increased. We went from roughly $1,700 per transport to now $2,200 per transport. And one of the challenges of the past agreement, which we had in place with AMR over the last 11 years, was that the annual increases that AMR could receive to keep up with rising costs. As we all know, healthcare is just getting more and more expensive. Labor is getting more expensive. They have a lot of medical supplies and equipment and ambulances that need to be reliable and maintained and upgraded over the years. All this has a lot of costs. AMR has also been operating for several years at a loss in Clackamas County, so we did recognize that. They are a for-profit company. They've got to be able to produce a profit, and they are, of course, a private business concerned about their bottom line. That was a factor. Just for some context, this year alone, AMR is experiencing a $3 million loss in their operations here in Clackamas County for ambulance services. Patient rates and increase, it is a concern. We did hear community feedback, of course. And our healthcare system is complicated. So for some additional context, 97% of our residents are insured. Health insurance does cover the bulks of these patient rates. But it's very individualized because it really depends on the health insurance plan that you have in terms of what your out-of-pocket costs look like. For anyone though on Medicaid or on the Oregon Health Plan, there is no cost out of pocket for those individuals. And really, we are concerned about the uninsured or folks who self-pay. On average, AMR transports about 1,300 of these folks out of a total of around close to 30,000 every year in Clackamas County. And something we were able to negotiate and keep in place and add a little bit more funding for was what AMR calls a compassion care program, where if you have a financial hardship, if you are uninsured, you cannot pay your ambulance bill, you can work with AMR billing staff and you can get a reduced bill and sometimes actually get that forgiven. So that's something we worked hard to keep in this new 10-year contract with AMR, and we're able to help us get to the finish line. Next slide, please. So this is the last slide, just to give you, it is in the packet, but just some of the highlights of what is in the new contract in case you're curious. So there are new requirements around all the performance metrics that they're held accountable to, really to align with current industry standards. A lot of our contract from the past really hadn't been touched a whole lot since the early 90s, and we really didn't need to modernize a lot of the requirements. As I mentioned, the compassion care program is still in place. There's new or updated requirements around technologies as things have changed, equipment requirements, response time requirements, clinical standards that they need to meet, and also more steeper fines that are now in place as well. We did put in the requirement, new service, nurse navigation. We find this to be really, really critical. It does help reduce the amount of calls that AMR has to go on and the amount of transports that are happening, where when a patient meets clinical criteria and maybe they don't need to have a fire truck and an ambulance come and take them to the local emergency department and give them an ambulance bill. Maybe they really need a nurse to provide a consultation and some advice and help get them scheduled for their next, or get them connected to a primary care clinic or other type of medical appointment that can wait. They can help them when they call and get them connected to the right, most appropriate care that they might need. Our contract now also allows for first time, it hasn't started yet, but AMR now has the option to begin doing EMT only responses for calls, again, that don't require as high a level of care. You can send an EMT out. It doesn't have to be a paramedic that comes, which is more costly. So another great way that we can stretch out resources. Ambulances are a scarce resource. We want to make sure that for those life-threatening situations, there is an ambulance available to help. And, this has just been a long ride. I know Commissioner Helm and Commissioner Savis are here. Wasn't sure if you want to share some reflections on this tough negotiation, but really it has been a lot of engagement with our EMS system partners. We have a really strong EMS council at the county that's help to guide all this work, provided input on the contract, on its contents. Our local fire chiefs, they were engaged all along this process. Our hospitals, our 911 centers, law enforcement, I mean, you name it. It really was a whole community approach. Very proud of the work that we've done, while also recognizing that the financial piece, of course, is a concern and something that was just necessary to do in order to keep AMR viable and a partner to continue serving our community for the years to come. So with that, I'll pause. Wasn't sure if Bill or one of our commissioners have any comments before we open it up for questions and discussion.
Well, Bill, you're a subject matter expert, so I know that we put our staff, both Philip, and Bill and others through a lot of hell because we're trying to get make the best out of a very difficult situation. But Bill, any thoughts?
No, just we appreciate your all your leadership and the collaboration between the agencies and stakeholders was absolutely amazing. It was great to have. I mean, we basically created the contract with all of their input. So a lot of these changes that you see, or that you just saw in the presentation, actually came from our stakeholders. So again, as Philip said, very proud of the work we've done, and just here to share and answer any questions for anybody on the panel.
Yeah. just a little bit before I recognize Commissioner Helm, I also work with some of our fire agencies or members of the firefighters in different areas, and just to get their sense of the impacts. And there was a period of time when service was compromised, and I think they were picking up some of the slack and responding. And so we were hoping, number one, that the load on our local fire agencies was less, coupled with was AMR coming back into compliance. I think that was part of the reason, frankly, that it took so long. We wanted to see improvement, and we held firm on that. And until they were making gains, is really, if you just look at the reports and their performance measures, we didn't sign this thing till they were back in compliance. So, Commissioner Helm.
No, no, I was going to agree with that, Paul, because it's and I had to get up to speed on this real quick when I first started because it took, and Philip, thank you. It took numerous meetings because there's a lot of history here. But I think one of the things that was pointed out was how long we went without a price increase. And when you do that for a service provider, and then the world changes, COVID, you had lack of help, you had lack of labor, staff. It was like the perfect storm. And I appreciate all the work that was done to get everything back up to where it needed to be. And it was not an easy decision, but it was a decision that had to be made to go ahead and do this jump and approve this service. But you guys have made remarkable progress in your response times and everything. So it was good. It was hard but good, and I appreciate all your the education that I got along the way.
Back to you, Mayor.
Mayor Buck, go ahead.
Thanks, Mayor. Thank you for the presentation. Can you maybe talk a little bit about how the county's contract kind of impacts like the work that we see AMR doing, and I mean outside of Cambia and Malala, those service districts. I know all of probably many of the other cities represented here. AMR works hand in hand, with local fire departments, and um, what's the relationship between some of the like municipal relationships with AMR and the county's relationship?
Yeah, sure. I can speak to that a little bit, and then Bill, please help. But we do have IGAs with several of the fire agencies inside the Clackamas ASA. And so for Lake Oswego, for example, they, as a first responder, they have an IGA between the county and us, when they show up on scene first, they get payments from the county, and it helps AMR meet their compliance. So it really is a partnership. And then there are Clackamas Fire in Tualatin Valley right now. AMR subcontracts with them as well. So it's complicated. The system's super complicated, but that allows for Tualatin Valley and Clack Fire on occasion to go and do the actual transport on behalf of AMR. So there's lots of ways in which the local city and AMR are partnering together within the Clackamas region. Yeah, it's complicated though, I'll tell you. It took me a long time to learn this. I've been doing this now for almost 10 years with Bill.
Philip, can I ask, so Clackamas Fire transports on every call where there's
Not
a
every call, just some.
not every call.
Yeah.
And really, it's when there's high demand on the system. When AMR's got multiple transport and calls that they're on, it helps that that trigger can be turned on, that then fire can go on transport as well. They would get assigned to do the transport. Yep.
Has the county I'm just curious, studied the kind of financial is the contract with AMR of financial benefit to the if we think broadly, like the county and the jurisdictions, is that a win in terms of having the resources to respond to calls in the right way and in the right time and all of that, or is there some future where our fire personnel and departments who I don't know if this is consistent throughout the county, but I mean at least in LO, I mean they're all paramedics, and they primarily just run the medical calls. where they take on more of expanded role doing transport. Has that been looked at? Where the financially how that would pencil?
Yep, it's absolutely been looked at. In fact, when we were starting to develop the update to the ambulance service plan, we hired a consulting firm that came in and looked at that very issue. Bill, can you speak a little bit about maybe just some of the pros and cons, I guess, of that approach? I know
Sure.
it's being looked at nationally too, of course.
Oh yeah. Yeah, they looked at all kinds of deployment models. They looked at hospital-based models. They looked at fire-based models. They looked at county-based models and county-owned models. And what they found with a lot of the models is it takes so much capital up front to start the system that it take that and then take what the transport revenue ultimately is. It's kind of it doesn't really pay if that makes sense. So and the fire agencies like Canby Fire Transports, Malala Fire Transports, but in this Clackamas ASA, it's so geographically diverse and difficult to serve that, and you have so many multiple fire agencies serving the area that it's you'd have to have probably one fire department willing to take on the entire Clackamas ASA. Most likely, this is based on our consultant. And I don't know if fire agencies are in a position to want to do that. No fire agency right now, in my opinion, could do that based on their current staffing. So you'd have to hire more people, purchase ambulances, again, the capital purchases. So yeah, they looked at all of that though. And right now, this is based on our consultants, in my opinion, are certainly our best option.
Thank you very much.
Mayor Milch.
First, thank you for the innovation of the nurse navigation system. I think that will be a real cost saver. Second, I didn't know this until I was watching meetings that they had a few years ago when the county was looking at the impact of tolling on the area, and there was a representative, I think, of AMR on one of the committees talking about ambulances needing to constantly kind of move around and stage in different areas. And that was something I wasn't familiar with. I used to live near an area where I think AMR had an office up near 17th Avenue between Milwaukee and Selwood. And I thought, oh yeah, there's always and I lived close to there. And I thought, oh, there'll be an ambulance close by if anything ever happens. And I realized now that's not how it works. You guys are trying to spread yourselves all over. So one of the places that you have helped our city is that for many years, we've had ambulances and staff on hand at High Rocks Park along the Clackamas River to provide sort of, emergency river rescue if needed. And that's been a great thing for our city. And I guess because it's close to I-205, maybe it's a good place to stage an ambulance and, have a lower cost impact. But is there a chance we could get a program like that continuing? And are there other areas and other communities that benefit in the same way from having ambulances kind of staged at an area where there may be other kinds of emergencies?
Bill, do you want to speak to that first?
Sure. So what you're referring to, Mayor, is it's called a system status plan. And what they do is they have posting areas across the county. And they do this. It's a very robust computer program that they use that looks at risk, call volume, things like that. And they'll post at these certain areas. They're all specific posting locations, and they do it based on call volume and risk. And if the post that's, say, the busiest, that post takes off and gets a call, then they may take from the lower post and move up there. Just like you said, they're constantly moving around, filling in the posts that get the most calls, basically. So that system is up and running, and that's how it works in the Clackamas ASA. So I'm not sure what you meant by will there be additional plans like that? Can you elaborate on that?
Well, only thinking that, if one of the places where you had people on hand was at an area where it's good to have some people in public safety, like High Rocks Park on Clackamas River, that's been a benefit to our community. So I'm hopeful that something like that can continue and still work within the framework of this system where you move people.
Right. Yep. I understand what you're saying. That would be a question for AMR as far as that specific posting location. But again, it is based on call volume and risk. And again, if they had a unit there and then they got a call at another location or had to go post somewhere else, that unit's going to be gone. So they just literally move constantly.
Yeah, I see. It can't be 9 to 5 every day in the summer.
Exactly.
But thanks. We've appreciated having them the years we've had them.
Mr. Helm.
Yeah, just a couple things. I wanted to mention that I had spoken to the PIO for Clackamas Fire, and I've some the chiefs and ex-fire chiefs, and the nurse navigation part of this has made a huge difference for AMR's response times, and I think it's only going to get better from here. But somebody gave me the percentages of how many calls were not needing actual transport. They needed the nurse navigation system as instead of. So that was really good news. And then to Mayor Buck's question, and we had to all ask this question too: is this something the fire departments could eventually take over? But if you think about it, if there is a house fire or a commercial fire, and all of those units are called to a particular type of fire, they're not then available for transporting people that are needing it. So it's been discussed many times, and it doesn't pencil in the real world. So yeah, it has been talked about.
Hi, Commissioner Sabas.
Yeah, Philip or Bill, whichever you wish to reply here, either of the two. Little known fact here is that just because the rate is, let's say, $2,000, can you speak to the actual amount they actually get? Because that's reduced by either insurance or Medicaid, Medicare. So they don't often get that amount of money. They get a much smaller amount, just like a hospital bill. They'll bill X, but they only recover a percentage. So whoever can speak to that, that'd be appreciated.
Yeah, I can start. Every health insurance plan that an individual have, it's going to be different. Some private health insurance companies will pay that full $220. Some it might be they'll pay 2,000, but then the patient's going to pay $200 unless they've met their annual deductible. Our health insurance financial system at play there. But if you're on Medicaid, if you're on the Oregon Health Plan, Medicaid's going to pay $800 of that 2,000 and $2,200. They're going to pay $800. That's all AMR is going to get. Nothing's going to go to the patient. That's it. So essentially, they lose money on that call. Just that's an example. Yeah, I'm pretty sure it's accurate. Correct, Bill?
Yes, that is accurate.
Yeah.
Very few of insurance companies will pay that entire amount. They have contracts and relationships, and very few insurance companies will pay the entire amount based on their relationship with AMR.
All right. Is there any other questions for these fine gentlemen or comments about AMR? Okay. Well, gentlemen, thank you very much for the update. It's very much a general thread here. So thank you, Jamie, for kind of bringing all these emergency pieces here together this evening. So it kind of rounds things out. So, gentlemen, thank you. Appreciate it. Appreciate the commissioners for helping do some of the heavy lifting here to get this to the finish line. So thank you, guys. All right. We're clipping right along here. Let's see. Gosh, I think it's time for Trent and his stories of the legislature.
Hi, thanks for having me again. Always a pleasure to be back at C4. I think it's a good thing that I'm on deck because I'm earlier than scheduled, which means y'all are ahead of schedule, which is a really nice thing for C4, right? Everyone's excited about that. All right, so I have two things to report about today. I'm going to talk a little bit about the transportation package. I'm going to talk a little bit about the government shutdown, I think those are the two legislative updates that are top of mind for most of us. I'm going to keep it high level. I know some of this could feel or be partisan. I'm going to stick to the data and the objective facts here and take from that what you will. So on the transportation package, it passed on Monday around the noon hour. The legislature was able to meet, the Senate met, and it passed on a party line vote. So that is done, and it will take effect after 90 days from passage, which is about a couple days before the new year. So around December 29, 30 is the expectation for when that will take effect. That is coincidentally the same amount of time required for a referendum to take effect, and there has been a little bit of media about whether that's a potential or not. So if that's something of interest to you, be on the lookout for it, one way or the other. Assuming it passes, here's what that bill, or it did pass, but assuming it goes into effect in January, let's just say January, here's the things to know about for it. Nothing's really changed from the early reports that I've given in the past, but I'm going to repeat them here for us today. There is increased accountability for ODOT. Some of that is just some maneuvering around the organization of ODOT. Some of that is changing the governor's ability to select future directors for ODOT. So there's some devils in the details on some of that, worth looking into a little bit deeper if you have any particular accountability mechanisms that you are fond of. The numbers that are top of mind for folks is that the gas tax will increase by 6 cents. It's currently 40 cents. It will go to 46 cents starting in that early January timeframe. Title fees will increase by $139. The base registration fee will increase by $42 a year. These are per year numbers, I believe. For the registration fee, definitely. And also the supplemental fee for EVs or high efficiency gas vehicles, like 40 gallons or more, will be a $30 increase on top of the base increase. There will be a vehicle miles traveled program or road user charge, whatever phrase you like there, that will begin implemented down the road a couple years from now. It'll start directly with electric vehicles, and then it'll start to roll in various hybrid vehicles. And then the other one that's not a single occupancy vehicle but bus related is that the payroll tax will increase by 0.1%. It is currently 0.1%, so it will go to 0.2%. So it'll double, is another way to say that. That is in effect with a sunset. So that sunsets in January of 2028. And that is a result of a compromise that happened in early August when the legislature got off to a rocky start and there needed to be some negotiations to get some folks in the building. So that, if you're a fan of transit, you should be aware that that sunset is, for lack of a better phrase, or maybe even to lean into the pun, on the horizon for those who are needing to track that. So those are the big numbers to be thinking about. Like I said, this goes into effect right around the new year, and that's 90 days out. I have not looked to see if the governor has signed it today. There are many things happening in Oregon that the governor is paying attention to, as you can read in the news, but I think that this might be one that she'll be looking for as well, because there's been a lot of news about the need to get this done for ODOT jobs. There was a good presentation by ODOT that happened at the Joint Committee on Transportation on Wednesday afternoon by Travis Brower and Daniel Porter that spoke to when that money comes online, what that looks like for ODOT operations, when they'll start planning for it, when they can start hiring some of those unfilled positions that they've been sitting on or holding on during this conversation. Top of mind for them, if you listen to that report, is thinking about winter operations and requirements for winter operations. And so they're going to hold on actually taking on any jobs until the money starts to start to come in, is able to be collected. But I think, are going to try to work on some of those right now gaps to try to be prepared. But because it has passed so late, they will be a little after the snow season begins before some of those folks come online. And they even spoke to the time. It's not just hiring somebody. There's also do you need a license? Do you need to run some mileage before we release you with a plow truck? So there's some training involved with some of that work as well. We're thinking about to fill those vacancies. So it's not an immediate, turn the keys and go. Maybe for some of them, but maybe not for everybody. So it's an interesting presentation that they provided. That is the update on the transportation package. One of the longer special sessions we've experienced, at least in my time here in Oregon. So that was not fun, and I don't want to do it again, and I don't think anybody else does either. But everything now is looking towards the short session here in 2026. I think the big news there is that it is there's a budget problem that Oregon needs to figure out. There's a lot of money that Oregon needs to find. I believe there's an $800 million hole in Oregon's budget as a result of a number of things. Some of it is the economy, some of it is the revenue that's coming in or not coming in. Some of it is the impacts of HR 1 at the federal level that passed back in July. Pick your poison. The result of that all is an $800 million hole that's being reported. And the Oregon legislature closed at the end of June with about $500 million available to them. So the message there is that there's about $300 million worth of cuts, at least, that the legislature needs to figure out what to do with if they can't figure out how to raise additional revenue. And that's an option. They could potentially raise additional revenue. I personally do not feel like the exercise in the last month with the transportation package gives me any confidence that that's really on the table, especially in a major election year. But that is potentially a pathway that the legislature could go. In other news, and I'll just run through this quickly, and then I'm happy to take any questions that I can possibly answer or get back to you if I don't have an answer to them. Is that the federal government shut down on Tuesday night, so we're at the very end of day 2. Based on what's in the news and the negotiations that are being reported, it sounds like they're not close to finding a resolution to this. And so it could be at least a few more days. It could be a few more weeks. The longest government shutdown in history was in 2018. It was 34 days. That's it. I mean, I'm not in DC right now, so I don't really have like the behind the scenes like I sometimes get to do with the Salem stuff. But you can tell by the news that it is very intense. There is a lot of efforts to try to find some sort of compromise, and really what they're trying to find compromise on is a short-term continuing resolution that just funds government through a little bit of time for them to continue working out a new budget, specifically a budget that reflects the values or goals of this current administration and this current Congress. I should just remind you, we are currently, well, actually, we just finished, but 2 days ago, we were currently under a year-long continuing resolution under the previous Congress and previous presidency. So we've been operating under, if you want to call it this, Biden's budget, in reflection to like this current administration, this current Congress. They have not been able to have a budget under their priorities. So they need to find a short-term solution now to be able to finish negotiating that and have their own sort of approved budget based on their priorities of their majority leadership. So those are the big headlines that I feel important, like that I feel like are important to share with you and talk about. The impacts of a federal shutdown, in my memory, are slow to reach you early on in these like earlier days. But after about a week or two, you start to see it affect federal contracts that counties and cities, have to navigate or negotiate or depend on. And then after about 2 weeks, you start to see the healthcare impacts start to trickle in. So that's the ticking clock.
Always fascinating, Trent, as always.
Well, I always tell people when they ask me, Trent, why do you do that job? I say, it's never boring, is my answer every single time.
Well, as you were talking about, these continuing resolutions and whatnot, I just thought I'd um, throw into Google here that apparently the last time the federal government passed a balanced budget was in 2001. And the last time it operated in a surplus was 1969. So many decades of inefficiency and poor planning. Fabulous.
There was a federal government that we used to have that would loan money to others and get paybacks. Now we are taking out loans, and that's a big change in in our government spending plan. It's just an observation from Trent. But yes, it's been a long time since the federal government has approved a budget on time. And by on time, I mean by the end of September. There's historically been a continuing resolution that's pushed back some sort of approval by a couple of weeks, if not a few months. It's been the trend.
So, yeah, I wonder how much longer we can go until we come up with a Clackamas County currency and just print our own.
If you really want to talk about inflation, that's the way to get there.
All right, a conversation for another night. Don't we're ahead of schedule. I'd like to keep it that way. Trent, as always, the harbinger of great news.
Hey, transportation package passed. That is politics aside. That is revenue to counties and cities to solve road dilemmas and road problems and pavement and potholes and bridges and culverts, guardrails, tree removal, site work, paint strips, bike lanes, whatever you need to prioritize with that revenue once it starts coming in. That is a positive outcome of this good work. We have a lot of jurisdictions and a lot of residents who depend on those safe roads. I know that's a priority for all of us. So I do want to end on a positive note that is a potential future if this is not referred for our jurisdictions to be able to deliver those good works to the public of Clackamas County and its visitors.
Well, Trent, I too am a glass half full kind of guy, and I hope that everything that you just laid out there comes to fruition. All right. Well, thank you, sir. Appreciate it. So, moving into updates and other business. How about a JPAC update? Anybody got one?
Yeah, I can jump in unless Mayor Buck wants to.
No, go ahead. Go ahead.
Yeah, we got a lot of updates. There was obviously the trip to Washington, D.C., so we got an update on that, and a legislative update as well with everything going on. The really topic of discussion was the climate action plan, and very high level. And I really I won't go into great a lot of detail about the climate action plan other than tell you in preparation for the RTP, they make a lot of assumptions, and I'm not being critical, but I will just tell you that when the RTP was last up a few years ago, I spoke to some of those assumptions and thought they were unrealistic, and it appears that that's still the case, and we need to look at maybe some other ways of recalibrating or investing in technology, in my opinion, to meet those requirements. They are requirements. But too much emphasis on behavior change in an area where we have little transit and we don't really have a system, a backup system for if you want to encourage people or push people out of their cars, we don't have a sufficient system to get any alternatives. I mean, so therefore, here we are 20, 30 years into this behavior change model, and it's not really working out. We have some shiny or not, we have some shining examples of good transit in some areas, but that's not a majority of the region. So I'll end there unless there's questions. Okay.
Right. We'll move into MPAC.
I can talk about impact, I guess. I'm getting a lot of overlap in these these meetings, but Impact's working on the future vision. So they gave us a little update on how things are going with the future vision. Talked about the cooling corridors, and a little just update on the regional housing coordination strategy, and then actually had kind of an interesting presentation by a professor named Dr. King. I think she's at Portland State. Her field of study is like how the built environment impacts public health, and MPAC invited her to come in, and she gave a very interesting, and all of her data is related to the Portland region, and it was pretty fascinating. It was one of the best presentations we probably had at MPAC. So
So you'll have to excuse me, Mayor Buck, in my lack of expertise here, but explain cooling corridors.
Well, I wrote it down. And as I was reading it, I was like, what the heck is this? We got the emergency corridors. We got it's got to be, yeah, what the heck? Cooling corridor. Has anyone else heard that? No, I'm wondering.
Are you just pulling that out
What
of
is
thin
it?
air there, boss?
Mr. Sass.
Well, maybe Commissioner Helm, who's our impact rep, might add. I know what they are, but maybe Commissioner Helm, being her impact rep, can fill that gap there.
The way I understood it was, so especially with the presentation by Dr. King, the areas that are affected by all the traffic that's going through, they're trying to create a cooling corridor because all of that affects people's health. So, right? Isn't that, Joe? Am I on the right track?
Yeah. Yeah. I mean, it was based, I mean, it's no surprise, right? I mean, you take like all of the areas around the freeways where they have been like kind of denuded of the tree canopy to make the transportation infrastructure. Like those are the hottest, areas. And then of course they also happen to be the lowest income areas.
Of course.
And so there was a real correlation between the higher income areas, big tree canopy, less freeways, lower income areas, less positive health outcomes in all of the, we're really centered around the freeway system. I mean, that really was.
It really is. And Dr. King's, all of her presentation was strictly scientific. It was fascinating. And it's not anything we don't know. I mean, just think of the Rose Quarter area, the Moda Center area, it's where all that traffic creates just such a climate cluster right there. And, they're trying to address it. This is a long overdue issue they're trying to address. So, yeah, and it's kind of complicated. It's her presentation was fascinating. Yeah.
Well, it sounds like, yeah, you guys hit it on the head there. It sounds like here in Portland, I mean, they're saying, what I just pulled up here was that 82nd Avenue is like the #1 area of focus because of just that is one of the, I think they're calling it one of the hotter or warmer areas due to traffic. And it is an interesting piece because I think when you look at like metropolitan areas, it becomes a bit concrete and asphalt driven, which one of the reasons I no longer live in the LA metro area is because of that. There are no trees. We at least have some here. So I'm sure that'd be a fascinating thing to hear more about for sure. Okay. Commissioner Savas.
Yeah, just add one thing. I didn't hear the presentation, but I have seen other presentations by Metro regarding this. And so I've seen heat maps. That's how they judge what areas are hotter than others. And Mayor, your city of Canby is one of the hot areas. So asphalt, putting aside traffic for a moment, asphalt, open areas, lack of tree canopy, as Mayor Buck mentioned, are areas that contribute to areas being hotter than ideal, I guess. So, a cooling corridor would include things like maybe eliminating some of that asphalt or concrete, putting trees or grass strips and things like that don't absorb the heat. So that's some of the remedies or mitigation for those areas. And certainly there's the traffic and the vehicles and all of that goes along with that. But as you know, anyone knows 82nd Avenue very well. Ain't very many trees out there.
There's not.
So there you have it, sir.
Well, we've learned about cooling corridors. Look at us, C4 being a plethora of information sharing. I love it. Okay. Any other JPEG impact stuff that we need to poke at? Nope. All right. Library task force updates. Mr. Mayor Milch.
We are meeting again next Monday, October 6th. Also, the new Oak Lodge Library, which is a county-run library, they had an open house tonight, and I saw it for the first time. And it is also opening on that day, and we'll have a grand opening ceremony on October the 18th, I believe it is. But as far as the library task force, we've sought input from cities to help us work out a couple of issues that are ongoing as far as how library funds should be used. There are big differences of opinions between some cities. Some, really in favor of their autonomy on how they use funds, even though those funds come from kind of channel through the county from both city residents and unincorporated residents. And some cities accept that obligation and do it one way, and some thinks we don't want the county telling us. So it'll be real hard for the county commissioners to come up with a single policy that satisfies everyone. But that's why they get paid the big bucks, and the task force has wrestled with this and will try to be supportive and find some, direct some good input to them on making those decisions. Ultimately, the Board of County Commissioners is the library district's governing board.
So Mayor Milch, just again, sitting from the bleacher seats here on this particular topic, it sounds like we're maybe staying as a status quo. Is that kind of where this group is leaning?
Well, I think different people have different understanding what the status quo is as far as those issues of how monies can be spent, city costs allocated through some of those revenues. But there's also a need to kind of look forward, a desire among library directors themselves to develop more of a mission statement, a strategic plan going forward. And so that's certainly a change from the status quo, because there may be different ways of looking at it. And then as far as the revenue issue itself, some cities feel that the amount of revenue needs to be higher, and therefore that would involve perhaps a dissolution of the current district and a reformation of a new district with a new tax rate. That's the only way, because you can't increase the tax rate on an existing district. So again, the hard decision on what to do will be up to the county commissioners. And I think one of them wants to weigh in on this.
Yes, Commissioner Sabas.
Yeah, I agree with everything Mayor Milch has shared. He's one of our representatives on there that represents urban mayors, and the Mayor Sandy, Mayor Walker is the rural mayor representative, and Mayor Hodson, you and I got a chance to catch up earlier this evening. My question to you was, have you been in contact with any of the other mayors in regard to the libraries? And so the reason I asked that question is that, and Mayor Milch alluded to it, so there's a representative for the library directors. There's a representative from the city managers. There's a representative from rural mayors, or rural cities, and also from urban cities, and then a couple folks that represent. One gentleman represents the LDAC, Library District Advisory Committee, and there's a citizen committee or two member in there. So ideally, each of those reach out to their constituent groups, right? The rural mayor reaches out to all the rural mayors, and the urban mayor reaches out to all the urban mayors. And I don't know to what degree that has happened. And then we need to rely upon, if they did reach out to those folks, let's just say someone reached out to the mayor of Canby, and the mayor of Canby didn't reach out to his council. Do we really have a representative message coming from the group collectively, and then again presented to the county commissioners in the near future? And my concern is that there's a little bit of a breakdown. I can't say where or what, but I did see some of the survey data, and so we have a meeting on Monday, I believe, Mayor Milch, and so we'll find out. We'll get a report of what the survey says. But I do have a question, and maybe just raise your physical hand in the screen so I can see it. How many people have been contacted? Please raise your hand, and Mayor Milch and I will stand down on this one because we're at the table. But anyone been contacted? And I only know that's not fair because we only have two mayors here tonight. I know we have a light group because tonight is also the LOC or this week's LOC, so League of Oregon Cities is meeting. So we have a light group here tonight.
Well, Commissioner, are you, I know that the recommendations were being circulated,
okay.
talking about. I know that they, and we were sharing those with, I know they got shared with my whole council.
Okay. Councilor Callahan, any input, sir?
We haven't been contacted at all, as far as I know.
Okay. Yeah, we need to make sure because I mean, I don't know where it's going to end up, but let's just say hypothetically to Mayor Hodson's concern or question that he had, if if we don't know what the status quo is and we're left with the status quo, is that going to be okay with everyone? And there are some libraries that are financially constrained and had to cut hours substantially to survive, and yet there are also some cities that don't have that problem by a long shot. So, I guess that's really a question. I know that Canby is one of those cities that is financially constrained and has had to make a severe cut for library hours. So if there's not a remedy in there and the problems still exist, I'm not sure how we as county commissioners, when we get the final report, will be how we'll respond. But I'm just hoping that, and I'll echo what I've heard a little bit. Mayor Milch, have you some of your cohorts on the urban city side? Have you heard? What have you heard?
I reached out to all of them, asked them to respond, and it was the kind of thing where the date that they needed to respond was so far in the future. I think some of them thought I'll do this later and maybe, didn't get it done. I've heard from cities where maybe it wasn't just the mayor or the council discussing it, but maybe the mayor and the library director and the city administrator kind of got together and gave a position of a city. And in other cases, I heard just directly from the mayor. So the feedback I've been getting, though it's been so broad in its difference, there wasn't a strong consensus. That's why I say it's going to be difficult to find a strong an easy solution going forward because different cities have approached it differently. I did hear from I sent a question to the mayor of Happy Valley because a citizen from another community had some concerns about the way that city was using library funds, and I got some clarification from Happy Valley City staff that really helped me put that in the proper context. And so the conversations I've had have been useful, and I'll try to bring all of that to our meeting on Monday.
Okay, great. So we'll keep you all informed. Thank you, Mayor Milch, for making sure this is an agenda item, and thank you for your reports.
All right, the OHNA rulemaking calendar.
Yeah, I can take that one if it's okay. Okay, great. By way of background, House Bill 2001 from 2023 directs the Land Conservation and Development Commission, or LCDC, to adopt and amend rules related to housing and urbanization, which are land use planning goals 10 and 14. The goal of this rulemaking is to implement the Oregon Housing Needs Analysis Program, which redirects the implementation of Goal 10 towards a more comprehensive framework. Where rules have already been adopted to clarify how housing need is defined, LCDC will soon consider rules addressing housing capacity and urbanization, or rather how we assess our urban growth boundaries, and operationalizing the OHNA Housing Acceleration Program. Those draft rules have been filed with the Secretary of State, and public comment will be accepted through November 7th. On Thursday, October 23rd, LCDC will also be hosting a public hearing. Within the adoption timeline, which is pretty quick, the adoption hearing is in early December. So this update is for your awareness only, recognizing C4's prior discussions around housing production. Staff engagement is also occurring. Last week, the Clackamas County Planning Directors Group received a status update and had a conversation about coordination. So that's all, just an update for your awareness that if this is something you've been tracking, the draft rules are now available. Thank you.
Thank you, Ms. Lorenzini. Okay. Gosh, we have like 8 minutes. What should we talk about? Mayor Milch.
Some of you know I stick pretty close to home most of the time, but last week I had a meeting with other mayors out in Tualatin and was taking I-205 out there, and noticed for the first time that there are markings on the shoulder of I-205 saying bus only. And I've heard Mr. Bashirs talk about this for so long that it was great to finally see some of that infrastructure coming together. But I did notice that because it's there and visible to me, it's visible to other people, and some comments on social media about how is this going to work and what's going to happen if somebody needs to pull their car over to the edge. And there were people out there who had the answer to that and understood that buses would travel at a certain speed and under certain circumstances. And if there was somebody on the shoulder because of an accident or whatever, that the buses would move over in the travel lanes. Dwight, you might have better information about this, but I've always appreciated your sharing this with us, and it's great to see the progress that's taken place.
Well, yes, thank you, Mayor. And we were out there, my team and I were out there last week running some tests, not along the shoulder, just trying to get the route, figure out the route and all that good stuff. ODOT has been an incredible partner on this. They started working on the shoulder, moving rumble strips, painting stripes. There is some signage that will be the last piece that'll go in. They're predicting completion by October 31st, and then we'll begin training on that piece. So we've got about 6.5 miles of shoulder, which is 3 times what we have on I-5. So this is going to be really incredible for our customers traveling from Wilsonville. We're planning to stop at Stafford, 10th in West Lynn, and then Oregon City at the shopping center there, and then on to Clackamas Town Center. So I'm predicting we'll probably get this thing up and running. The route will be up and running probably December, possibly January. We may have to push it into the new year, but it's exciting. And everything you said about the if there is a breakdown in the lane, we report those breakdowns, and a lot of times we can get the disabled vehicle and its occupants assistance a lot quicker than they would otherwise. We work directly with ODOT. We have the number to their hotline, I guess I'd call it. And so we call in not only breakdowns, but we call in debris that may end up on that shoulder, and they send a team out and they remove it, as quickly as they possibly can to keep that lane flowing for us. But yeah, it's not a lane that allows us to travel at 55, 60 miles an hour. We can only travel up to 35 miles an hour on the shoulder, and only 15 miles an hour over the speed of the other lanes. So obviously, if the lanes are traveling at 20 miles an hour, you add 15 miles an hour, and that's your 35 there. So anyway, thank you for noticing that, though.
Dwight, what are the frequency of the runs of those bus lines? What's planned for that?
Well,
Is it
right
like
now,
just peak hour, or?
No, we're going to operate throughout the day. Peak hours, AM and PM peaks, we're looking at about half hour frequency, which is not bad. And then during the slower part of the day, the mid part of the day, the service will run every 45 minutes to an hour. Is what we're planning.
Would this just be Monday through Friday, or weekends as well?
Well, we're going to start Monday through Friday to start and see if how the ridership is, and if there's a demand for weekend service, and we'll look at that. I think more importantly to note that the service will be offered at there's no fare on that service. So you can literally ride from Wilsonville to Clackamas Town Center for as a fare free ride. And I was out in city of Sandy last week. They've kicked off a route between Sandy and Clackamas Town Center. So we are going to be promoting this ride between Wilsonville and the city of Sandy with just that one transfer at Clackamas Town Center. So, along with the other 14 routes, many of which TriMet operates out of Clackamas Town Center and the Max line there. I think it's the Green Line out of that location. So, yeah, this is huge for us, and we appreciate. And I know you guys have been listening to me for a number of years talking about this route that was coming. It started when the idea was formed when we started talking about tolling, and I wanted to give folks an option to not paying the toll, but using a bus, and it just grew from there, and it's finally happening. So I appreciate you all listening and supporting this idea this crazy guy had some years ago. So thank you.
Well, we talk about ease of access and connectivity, and I mean, to be able to get from Wilsonville to Town Center, where you're able to catch and hook up with one of the pretty major hub to do a lot of different things, that's significant, Dwight. So yeah, kudos to you and everybody that worked really hard to get to that point. I mean, I think that's our ongoing conversation about the success of mass transit is how do you get people to it to be able to use it, and this is a great example. So great job.
Thank you all.
Great. Any other community highlights real quick from anybody before I tell you all to go home? Oh wait, you are home. Pull the plug. All right. Anyone else want to stay on this meeting? All right, we're adjourned. Hey, before you go, next month is in Canby. So mark it on your calendar. We'll make it just a fun evening of festivities and conversation. More to come on that. So great. Now you can go. All right. Thanks, everyone.